It looks like we're ready to get started on this, obviously a very important session. I can't believe there's so many people here. I'm sure all the presenters are super excited. First, I'm going to introduce Rebecca Morley, who's going to moderate the panel.
I don't have the microphone.
It's not going to the room, it's just going to the Zoom call.
Oh, okay. Okay.
So Rebecca Morley is a friend of mine for many years. We worked together at the Missoula City County Health Department. The most creative, innovative person. I love working with her. And again, we're back at a presentation that we get to at least share a few moments together. Rebecca retired from the Missoula City County Health Department in 2020. She volunteers in her community in a number of areas, including as a Special Olympics clinical director for health promotion. And she's a lactation expert in the support group for new mothers. She works at Soft Landing, a United We Eat program for refugees who prepare meals from their own country, and then they're shared with the community who can buy the meals. And then all the volunteers get to join in and meet all these wonderful people who've been displaced from their homes and live here in Missoula now. We are such a welcoming community. And a couple of years ago, Rebecca was the recipient of the Special Olympics International Golisano Award for excellence in public health and delivering services to people with intellectual and developmental disabilities. It's a worldwide recognition for her work. She's very understated. You wouldn't know she's done so many things, but if you ever get to know her, you'll have a joyful series of conversations on hundreds of topics. So welcome, Rebecca, and she's going to help moderate the session so everybody gets a fair chance at talking. One last thing I'll say, as soon as the session's over, those that teach inclusive cooking classes or are working with organizations that do will have first choice of picking an item that they want from the accessible kitchen tools kits. So remember, we want you to take them, then we're going to disseminate the next layer. So before you leave, everybody will have a chance to get at least one item. Okay.
So hi, we are really lucky today to have a very rich panel of experts in accessible and inclusive cooking. And so I'm just going to briefly introduce the people, and you can look at their rich backgrounds by going online, but that way we'll have more time for the presentations and pick their brains and ask them different questions that you might have. So the first one who will come up and present is Jacqui Denegri, and she comes to us from the University of Kentucky in Lexington, where she's with the nutrition education program. She's works with the expanded food and nutrition program. And she was actually part of that Special Olympics Nutrition Initiative in Washington, D.C. that you've heard about yesterday. She also was recognized in 2023 with the National Association Teachers of Family Consumer Sciences Champions for FCS award at both the state of Kentucky and at the national level. So the one thing I really wanted to share with you, because I thought this was a wonderful thing, Jacqui's motto is stop, collaborate, and listen. And she has found this to be the most successful way to serve her community, including those with IDD. Just for the sake of being a little more efficient, I'm going to introduce our other panelists also. So second in this line of presenting will be Theresa Martinosky, and she comes to us from Summit Independent Living here in Missoula. She wears many hats, but one of her favorite things is to teach chew cooking classes for people with IDD. Also, she and her husband, who had a lifelong disability, had worked in disability advocacy at many levels, from personal advocacy on politics to the state and federal levels. So In her free time, she enjoys things like spending time with her dogs, her cats, and her chickens, as well as growing African violets. Then third up, we'll have Montech. Michelle Allen is a BA ATP in the assistive technology professional for Montech. Montech is Montana's free assistive technology resource and training center. She's had a lot of experience with both low-tech and high-tech equipment. And what she believes is that people can achieve their full potential with the right tools. And so she can connect members in our community with the tools that they need, including tools that help support success in independent food prep and self-feeding. And last but not least, we've got Katie Mednick. I'm sure you saw her out there with the Moms for Meals program. She's a registered dietitian and she's passionate about accessible nutrition. She's worked with many agencies to help vulnerable community members receive access to home delivered meals. So without further ado, we'll have Jacqui come up and talk about her program. Wow, I haven't had that welcome. That makes me feel so good. So yes, thank you to Mary, Rebecca for introducing me. Yes, my favorite motto, stop, collaborate, and listen. I guess that tells you like when I used to be really into music, and I'll just leave it at that. But it's worked for me. That motto has really worked. So like they said, I am from the University of Kentucky. I do nutrition education. Back in 2017 is when I started working with individuals with IDD. So you can see there's my group with the making smoothies. Let's see the next, how do I go forward?
Right up there. We also have the clicker just down below.
Oh, you have the clicker. I was like looking for the clicker. Okay. Technology is not one of my strengths. Okay, so I began working with Lindsay on this inclusive and accessible nutrition and cooking programs. So I'm going to play this little video for you. So this shows you how I got started. Oh, did it not go?
You just have to click forward once and wait. So
Click forward. I did, and it went to the next slide.
just a second.
See the arrow. You want me to click on the arrow?
Should just with one advance.
Oh,
Sorry, the other video's played.
so that one won't. Okay.
Maybe try clicking on the. Okay. No.
Nope, nothing. Okay, so let me explain this video. It was very inclusive. So I started this. When I started, there wasn't much information on how to be inclusive. And when I was approached by a friend of mine from church who her daughter is with Down syndrome, she said, do you teach kids? And that's my teaching background. And I said, yes, but I am not special ed certified, so I cannot do that. And then they were like, what? And because that's how I was taught. That's how when I got my teaching degree, if I wanted to get it, I had to get special ed certified. So they were like, no, just teach them some just basic, how to make a snack or something like that. So I said, okay. So this video showed you how I started. You can see there with a knife. It's a children's chef knife. So it's a plastic knife that's sharp enough to cut peppers, like soft vegetables, soft fruit, not necessarily a carrot, but that's how I started with the food safety and knife safety. The organization is called Down Syndrome Association of Central Kentucky. So that's how I partnered up with them. And then that's also led to other associations within the state and now going into Ohio. So we're expanding and it's all word of mouth. And one of the things I learned was some of the same issues that we have, right? Such as being overweight, diabetes, high cholesterol. These are some of the issues that we all have. This one I'm going to go through now the techniques that I use, my teaching strategies, okay? So on this one is know their strengths, right? So you have to effectively teach with Down syndrome, children with Downs. It's crucial to recognize and capitalize on their strengths, right? While they may face challenges, they also possess the most unique abilities and talents, and I'm always amazed by them on every day. So I tend to focus on their strengths, whether it's good social skills, whether it's creativity, or just the determination of getting that green pepper diced, you know? And then I celebrate their achievements. And this one is one of so that's Hunter. And Hunter, he's basically almost nonverbal, and he would not participate. Seeing all the others in the class start to chop and whatever, then he wanted to do it. He just needed that little boost of confidence. And then that made all the difference. Also, what you don't see is the others congratulating him of like, you know, good job, Hunter, you did it, you did it. So that was one of the other things that I wanted to show you. The next step is like creating small steps. So making learning better for them by breaking down the task rather than just sitting there and saying, okay, get your apron on, pull your hair back and do this. Just do simple steps. And by doing this, it's better for them because they can focus on one thing at a time. And it promotes their confidence, their success. And I make sure I outline every step, whether it's, I'll put steps on the board, on the wall, on the refrigerator, everything like that. So the next, here, let me go over some of their teaching strategies. Other teaching strategies would be, so allowing them to participate at their own pace, right? So however they feel comfortable. So like, for example, Hunter at the beginning did not feel comfortable holding the knife. He would, you know, touch it, move it around, but he did not feel comfortable holding the knife. So just let him go at his own pace. Providing a calming, sensory or fidgety items during the program. So I did have some other things. So if they needed a break, they could go to one part of the kitchen and just have that break. Then they would come back and join us. And then also I had to learn, because I tend to speak fast, and I had to learn how to like slow it down just to allow time for them to process the words and response to questions and like that. And then if something major changes from one class to the next, I'd notify the participants so they wouldn't be caught off guard, because that was one of the things that just would throw them, because establishing routine is another thing. And if I had to move kitchens, that would throw them off. And that was something. So explaining and notifying them like, okay, next week, we're going to do this. We're going to be moving somewhere else. And if I could show them where we were going, and just so they could just have that in the back of their mind. Avoid eye contact if it makes the individual uncomfortable. Hunter is one of the ones, he doesn't like eye contact. So I had to let him make the first move. So he made the eye contact with me. And so now he's even learned how to wink. So now every now and then I get a wink. So then I'm like, okay, that means I'm doing my job, you know? So it's, and so, and just avoid sayings and this is easy as pie, or when I'm talking about something, or y'all can do this, no biggie, no biggie, or just avoid those simple sayings, plays on words. And then I always try to provide a description before I'm doing the things, right? And then like an example would be like, I tell the participants, the blender will make a loud noise before turning it on, so get ready. And then if I notice, or sometimes I know beforehand that sometimes loud noises can be disruptive. So I choose not to do it, or I make sure that they know, and if they need to leave, if they're with their caregiver, their parent or life skill coach, they can either take them out of the kitchen for that moment, or I have them do something else. I may have them go get the plates, get the cups while I'm doing that part. So that was one of the teaching strategies, some of the teaching strategies that I wanted you to know. I said establishing routines. So there's a view of my kitchen. I call it my kitchen because I'm there most of the time. So establishing routines. So now they know. And I know you can't see very well over there, but on the refrigerator, I have their tasks listed, and every week it's something different. So whether it's cleaning the counters, sweeping the floors, doing the dishes, drying the dishes, putting them away, there's some tasks that they have to do. And then each one of these you can see, so we made energy bites in this one. So I have each group or each person had the peanut butter, all the things displayed on these disposable cutting boards. And just a side note, these are Dixie brand cutting boards. They are the most amazing invention because, I mean, I don't know, washing cutting boards, especially the flex ones, were always such a hassle. And these are disposable. So not only do I love it and it makes cleanup easier, but the kids love it because they're trash. So they're all happy. They don't have to wash it and dry it. Dixie should give me money for that. So some of the teaching everyday life skills, okay? So that's the routine. This is what my plan to come up with to help by collaborating with the teacher, with the teachers, caregivers, parents, collaborating with them. Self-care routine, washing hands, pulling their hair back, putting on aprons, money management, and I'll show you in the couple of next slides, budgeting. So they've learned how to budget, which then also included coming up with like a coin lesson, how we did money lessons, time management. So prep, cook, and clean up. When I first began teaching, I just had the prep and the cook, and I said, I'll do the cleanup. And that was me because I was like, oh, me thinking that's not going to be possible. They're not going to be able to handle that, blah, blah, blah. But no, you give them a task, you give anybody a task and they will rise up to the challenge. And that was something that they taught me. So when I included cleanup, they were excited and I made it exciting and they look forward to that. And they're like, come in and they look at what tasks they have that day. And I'm just like, oh, okay, here we go. They learned communication and social skills because they work in teams. And then we all sit down and we eat together. Nobody can eat until everything is done. So that is one of the things that I've taught and we've taught them, and that now it's a routine. So now all these everyday life skills go into the home, right? So a lot of times I would hear parents say, no, they don't sweep, they don't wash, but now they want to. Now they're helping in the kitchen. Now they have a chore. Now they're, they're prepping, they get a recipe, and now they want to go shopping. Now they do all this stuff. So,
Dishes, Hunter, what are you doing over there?
so they're doing dishes. And I'll let you know, they love getting their picture taken. And they do this. I have up on Facebook and with them, they look every week to who made it on there. Okay, so on this slide, this just shows you a little bit of the stuff of the sweeping and see how they work in teams, sweeping, cleaning the counters. This is Dahlia wiping the counter. She was not a participant. She would come in and she would just stand there. And if we were chopping foods, well, she would eat it, right? And she wouldn't do it. And if she didn't like it, she would spit it out. And just by watching the others and watching how I would go, if you see in the middle, that's how I have my table set up in a U shape where so I can go in front of them and show and see what their cutting skills are, or how to hold the knife and what they're doing and everything. And sometimes they just want to show me how everything's mixing. And now Dahlia is the first one. Her favorite job now is to wipe the counters. And she participates and she chops and she does everything. And that's also one of the social skills because they help each other. So it's not like I go in there, we go in there and we're like, here's how you got to do it. No, they help each other. And that's one of the goals is for them to be able to help one another. That's one of the things. Budgeting. So I am not a Canva guru expert or anything. I created this budget sheet on Excel. Went to the Kroger app, would take a picture, cut and paste broccoli or even Google and do all these things. So this is how they learn how to budget. So if you can see on there, I'd say, budgeting, we're going to concentrate on budgeting. Here's going to be your budget. And I would discuss with always include the caregiver, life skill coach, whoever in the budgeting, what you were going to do. And then they would say, okay, here's your budget. You have $20. We're going to make this recipe at home. And this is what we're going to do. So they would go in there and I would have them, if you have it at home, you don't have to buy it. So they would check the box and they would do this. So I would do this with every recipe. So it's easy to do on Excel, just go and do it that way. If you see on the top right, each student has a binder. So we created a binder where they would have like the worksheets and the recipes and they can take it with them and bring it back, which was something that we were still working on because I still have some of the binders that are somewhere in Kentucky. Including multi-sensory experiences. And by doing this, it enhances their understanding. So when this is an herb thing that we planted for them. So it enhanced their understanding and their retention. So when we made basil pesto, they knew, oh, I'm using my pesto that I grew in my garden. And they, were doing the hands-on activities and it just blossomed. So now we do an herb garden every summer. And I have to figure out different recipes for them to do, which I love. And it's such a joy to see them because they take such pride in it. It's so wonderful to see how they're like, I made this. I grew this. I cut it. I did everything. I cooked it. I made it. You're eating what I made. So on the next one, after every meal, after we have a food tasting score sheet that they have to fill out. So this enhances one, we were doing their comprehensive reading skills. So we're doing the skills. How does it taste? How does it feel? So, the texture, would you do this recipe at home? And then I added this question is like, at home, would you change anything? Well, at first it was like, no, I have to follow the recipe, right? Then I would say, well, okay, instead of, let's say, broccoli, could you use carrots? And then they're like, oh, and I get it. So now they'll do things. So like if it's a salad, they'd say, it needs chicken, or we did pancakes, and then they would say it needs chocolate chips. That's what I would add. And I'm like, okay, because they know Jacqui's class is all healthy food. So they know. So they know at home I'm gonna use a quarter cup of syrup. Just kidding. Because they know 2 tablespoons is a serving. So, so this is enhanced, and you see how they're sitting together, and it's enhanced their communication skills, their social skills. On this next one, you just see, that is Emily, she gave a speech. So the USDA, how they come and check and make sure everything's going good, and they want to see a program because that's the USDA. So Emily took it upon herself to write a speech about her experience with cooking class. I wish you could hear her speech, but instead you would hear me crying because I was recording her as she was saying that. I'm like, and all you hear is, oh my goodness, that's so sweet. Oh, and you hear that, so you can't hear. And then I surprised them. They have other college classes. So I surprised them to visit. And I know it's not a good picture, but they made salads themselves. They made a lunch menu for themselves. And I just surprised them to come in because I was like, I'm in the neighborhood. The teacher was not very happy because they all jumped up and came to me, but I felt good. I was like, they're mine. But it was such a joy to see that they're teaching each other, they're continuing, they're doing like they knew they wanted, I think they had pizza that day. So what would go with pizza? They knew a salad. And so they even made their own salad dressing, which was amazing to me. And then they wanted me to stay. And I was like, okay. And it was just such a joy to see how far that's come, from the beginning to now and how it's being more inclusive. You can't see here also, but it's at community college. Some of the other students are volunteering, coming in. So now it's becoming more inclusive. So let me do this one. And here's the last slide. They're always proud to show off their work. And here is like their reward, their certificate, and just the chopping. Lindsay's passing out a universal design. Lindsay and I worked on this pilot program to fill out a survey because we know the USDA loves data, right? And we have to collect all the data. So here's just a copy of a pilot program that we're doing on having them fill out. And I'll tell you, before, they would not fill it out. It was always the parent, the caregiver that would fill it out. But now they are actually reading. Some of them need help, but they fill it out themselves. So then this is more accurate data. So I could go on for longer, but my time's up. So thank you. How do I exit out?
Thank you so
There we
much,
go.
Jacqui, for that excellent presentation. It was so much fun to see that work that you're doing in action. We'll save questions to the end when all the panelists have had a chance to present. So next up, we have Theresa. And she's going to talk to you about her CHEW program.
Cool. Oh, good. Where are we? Afternoon. I'm Theresa Martinosky. I work with Summit Independent Living here in Missoula, and I use she, her pronouns. And for the visual, I am a short 60-something fluffy white woman with glasses and about shoulder-length light brown hair. And today I'm going to introduce you to Summit Independent Living's CHEW class, or cost-effective healthy eating workshop. So we're just going to briefly go through, let's see which one it is. Yeah, there we go. We're going to briefly go through a little history of CHEW, how it came to be, some of our goals, what we've done to build on the success of the program, and some input from participants that have taken the workshop. And I have a list of resources that I didn't get printed, but if anybody wants them, I did bring a sign-up sheet. So just give me your email and I'd be happy to share them with you. So a brief history of CHEW. I'm just going to kind of consolidate all this, but research shows that it is, it's highly likely that people with disabilities eat less healthy on the whole as their non-disabled neighbors. And there's several factors that contribute to that. One, of course, is income level. So being at or, the poverty level of income. There's also isolation, whether it's geographical isolation or social isolation. Transportation is a huge issue for people to be able to get to places sometimes that would have more affordable, nutritious food. And it's also been shown along that social isolation piece, and thank you, Jacqui, because all of your inclusiveness was a very good intro to this. That people that will cook or eat meals together are more likely to eat healthier meals. And which it's easy, think about it yourself. If you're home by yourself, you're probably not going to cook something as good as you would if you were cooking with somebody else. So in response to all of those needs, in 2019, Summit Independent Living applied for and received a grant from the Bill and Rosemary Gallagher Foundation, and CHEW was created. So some of the goals of CHEW are to provide hands-on cooking. We try to keep it small groups, 5 or 6 people. We get too many and it's just hard to have a lot of, a task for everybody to do. We teach people about healthy choices and healthy eating. We talk about the grocery shopping aspect of it, menu planning aspect of it, and budgeting. And then we allow people to experience that social interaction while we're doing our recipe of the day and all the pieces that go with it, like Jacqui said, the cleanup, the prep, the whole bit. And then it's been shown that people carry these things into their daily lives. And so they continue on with these healthier practices. So building on success, the first CHEW that we had, of course, we had to take a break like most people did during the pandemic. So the first CHEW class that we had after the pandemic was a huge success. People loved it and they wanted more. And when are we going to do this again? And what are we going to do next? So in the summer, this past summer, we introduced CHEW 2, Let's Get Grilling. And it was interesting to find out how many people in that class had never actually been allowed around a grill. We had one participant who is in her 40s, and her dad told her, "Oh, you're not going to be able to do that. That's dangerous. It's going to scare you." She was, as soon as I said, "Come here, you can do this." And she did it once. She was right in there every class period. She loved it. So CHEW 2, Let's Get Grilling was designed for the summer, of course. And we talked about, we used some different kinds of recipes, foil packets, healthy ideas for veggies. We did burgers and kebabs and even desserts. And we had a lot of fun. So important rules for all of our CHEW. Number one is that everyone participates. Nobody is left out. And whether that means they want to be the one, if they're not comfortable with the hands-on to begin with, they might be the one that's going to read the recipe and make sure everybody's following what needs to be done. And then, of course, all of those basic kitchen rules, like making sure your hands are clean. We wear aprons. We talk about how to handle meat and fish safely. We talk about knife skills and other equipment and using that safely, grill safety. And then one of the things that my mom ingrained to me when I was little, and we reiterate this a lot, is never walk away from anything that's cooking, whether it's the grill or the burners, or at least keeping a close eye on the oven. And that's important. And I say way too much, I'm so sorry. So these are just some of the things that we've heard from people in our class. And I'm really proud of these things that they said, because it means that they really are integrating these skills into their lives. It was just amazing to hear that they were taking these things home and being successful with them at home. And three of the participants we had in class all just happened to have the same job coach. I don't think they even realized it when they'd signed up for class. Well, 2 of them did because they lived together, but I don't think they all realized it when they signed up. So it was kind of fun because their job coach had come to class most of the time too. And she didn't, she didn't sit back. She was like right in there with everybody. Like we were all a big team doing things together. And then she talked about how some of the things that we had done, like how to plan menus, and we talk about shopping your pantry, you make your menu, you make your list of what you're going to need, and check your kitchen first. You know, do you have these things? Do you need these things? Then making your grocery list, you're talking about how to read labels at the store, how to look for good deals, how to read the shelf tags that tell you, well, just because this one's bigger than this one, is it really a better deal? Things like that. And so Julie said that, you know, these ladies took this stuff home and they were using it and enjoying it, and how much easier it made shopping days when they had that list planned out and people were buying on impulse at the store. So it felt like a win to hear those sort of things. And then this is just my the resources, some of the resources I use to bring in, especially building Q2 from scratch. And it's still going to be an evolving class. I'm not the first one that was involved with this, and I'm sure I won't be the last. But just from talking, and every time we would complete a recipe, we would sit down, of course, and eat together. We talk a little bit about what the next class was going to involve. There was even a time that I realized we weren't going to be able to get the ingredients that we needed for the next week. So we brainstormed together and talked about alternatives. And so that taught them a little bit about how to make concessions and adapt things. And so, yeah, thank you very much. And I did bring a couple of our cookbooks. So if anybody wants to take a look at them, feel free to do that. Thanks very much for your time.
Thank you, Theresa. Really fun and interesting. So it's exciting that we're seeing these active programs in the community that are bringing a lot of joy to the people that teach and for the people who can attend. So next up is Montec, and she'll be talking about, Michelle will be talking about how she adapts tools and people so they can work together for success.
Session over at 12:30.
Yes.
Okay. I will set a timer and try to speed through also. So I am Michelle from Montec. Has anybody heard of Montec? Okay, a lot of you. So I will speed through some of this. Anybody never heard of Montec? Okay. So Montec is a assistive technology program. There's a program like ours in every state. We loan equipment for free. It's like a library, so we don't charge anything. It's a try before you buy. So you just create an account online, you go see what you want to try, request it. We pay shipping to and from, or if you're in Missoula, you pick it up. We serve any Montanan. We don't require proof of disability, and we don't sell anything. I am not going to talk about these things, but these are some of the areas. We're just going to talk about cooking, but we do hearing and vision, communication, recreation, all kinds of different equipment that we have. Well, you can also do an appointment with me and we can go over all of the things and see what might work best for you, and then you take it home. I love collaboration. If the therapist can come or the nutritionist can come, that's also awesome. So most of our equipment is 30 days, some is 90 days, not very many things, and 6 months. So you'll see it on the website, and then appointments are free. So now we'll talk a little bit about adaptive cooking. First, does anyone have any questions about what Montec does? Okay, I have a prize if somebody wants to say something that they have borrowed before from Montec. Yes.
For my husband, I borrowed chairs to use in the shower, because I didn't know what height to get or anything. I didn't know. So it was.
So I'm glad you brought that up. You probably got a chair for free. We don't keep any bathroom equipment, so we don't keep shower chairs, toilet equipment, anything like that. So, but if somebody has a shower chair, they donate it to us, we donate it right back out. So that is one thing we don't keep in our inventory.
Well, I know, you can ask somebody else.
All right, so here are some can openers, jar openers, thinking about taking that pressure off of your hand, depending on what you're doing. The second one over is Dyson, if you've ever heard of that, but you could also use shelf liner. So shelf liner is pretty cheap. You just cut it into little pieces. You can use that to open things. You can use it to put under your plate so your plate doesn't slide if you have tremors or you're moving quickly. So these are things we have in inventory, but also make opening jars and cans much easier. So this is some food prep. Has anybody tried any of these things before? Yeah, you guys have, of course. So, we talked about the plastic knives. We have some of those. There's the cutting board. We have 3 different kinds of adaptive cutting boards. They hold your food so you can slice. A lot of them are for one-handed. The knife up in the top left-hand corner is for arthritis. So instead of slicing, your wrist is straight up. So the same with the spatula in the bottom corner. And then thinking about low vision, we have some talking, measuring. Utensils. Yeah, talking things, so you can see how full something is. And then, you know, thinking about your cutting board, a black or a white cutting board, depending on the food that you have on it. This is my favorite. This is called the color-coded chef. This is on the left-hand side is a picture of one of the pages, and it really goes step by step through the directions. I will pass around just a simple one that we made. But it goes through step by step and everything's color-coded. So it will say you need 2 blue of this one, and you grab 2 blue. So everything is color-coded. So if you have trouble with measurements or numbers or dysgraphia, everything's color-coded. And this is something you can also borrow. This is the June oven. The June oven is amazing. It's a smart oven that's countertop, and it can see a picture of your food and decide what it is and tell you how to cook it. So takes all the guesswork out of it. Unfortunately, the June oven is not sold anymore. I found this comparison. We don't have it. Hopefully we can get it. But you can see it recognizes your food and it says, are you cooking this or this? It does 14 different functions. So you can say, I want to air fry that. And then it will do that for you.
Hi,
I'm gonna skip the video. Safety. So we have no tech and we have smart tech. Does anybody have any examples of safety in the kitchen that they've done?
When you cut yourself with a knife, I guess or something, gotta take care of the, you know, run your finger under and kind of under the water and kind of make sure to get a Band-Aid on right away or something.
Yeah, so safety in the kitchen is really important, and I think we sometimes think these things are common sense, but they are not. So remembering that we need to teach all aspects of safety. This is a push-pull to pull the oven tray out, and then these are safe guards that go on the oven so that you don't hit your arm and burn it. And then on the other side is smart knobs. They go on your oven. They can tell you if the oven got left on. So you could put that on someone's oven in their apartment and then have access to see if they left the oven on your phone from your house. So just being able to live more independently with some of these tools so that they have safety and can be independent. Adapted dishes and plates. We have all these like plates that have the sides on them. So if you're scooping, you have a place to scoop to. So if you can't use your other hand to scoop to, or if the food just keeps falling off the plate because you're scooping too hard, lots of different types of adaptive plates. And we do have some that have suction so they can suction to the table.
Are there any that keep your food warm though?
Yeah, so we have one that's called, like, it's a hot plate. The outside rim stays cool and the inside stays hot. And so you just microwave the plate and it stays warm. And that is really important for those people that are really slow eaters. And so they might not eat everything and you think they're not hungry anymore or they're being defiant, but really their food is cold. And I have a friend who's a speech therapist that discovered this the hard way. And she tried our hot plate and that person ate all of her food from then on. Then we have some different utensils. Has anybody tried any different utensils? Yeah, anybody else? So here's some examples of utensils for different, that you might need for different reasons. We have bent forks, so when you come up, you're not having to come straight. We have the Ellie spoon, which is being passed around, so you can come to your mouth like this instead of straight on. So if they don't have the control to come straight on, they might come the other direction. And then we have some weighted utensils, so that might be for tremors. The bottom one is called a sup spoon. That is for people with tremors. It holds a little bit of soup down in the bottom of it, and then you just pour it in your mouth. So that has been really popular lately, and people actually try it and then they go buy it, but they didn't want to buy it because they didn't know if it'd work. This is our feeding robot, and I think we have 1 minute left.
How do we do the applesauce? We're trying to crackers. No way to make you some, I have scrambled eggs. Would that be better? No.
Oh, dang, watch the, wow. Here it
Okay.
comes. Ooh,
So we got her way too big of a bite. But you could see in that video that she used that one finger on that hand to hit those flat plates. And that's what activated the robot to feed her. And we have these for loan. We used to not loan them, but now we do. The VA will purchase those, which is really nice, and we'll help you with funding if you need one. There's 2 kids in this area that actually have them. And some adults. These are some reasons that you might want to use Montec. And then the referral process is easy. No need to prove disability. You can schedule an appointment really easily. I do have a few more prizes. Raise your hand if you know how much Montec costs to borrow equipment. Yeah, it's free. It's free. Good job. And let's see what else. Is there any of this equipment that you saw and you thought, that's one I want to try? And I have several prizes, so raise your hand if there's anything you want to try. Yeah. Okay, so she said that she wants to try the sup spoon. So that's a really good example of not knowing if it would work. Anyone else have something they would like to try or have a client in mind that they're thinking, yeah, that was a great idea, or there's something you've never seen before? Yeah.
I've never seen a remote monitoring of the stove. That is awesome.
Yeah, we did a lot of research to find that. That was hard to come by.
I don't need a price.
Okay.
Thank you, Michelle. Here in the community where we can buy something before we buy it to make sure it works. Last but not least, we have Katie coming up to talk to you about home delivered meals. We're gonna extend the session about 10 minutes, so if you can do it like with 8 minutes, we'll still have a few minutes for questions. I wish I had an hour for each of you because I think we could easily have spent an hour for each program.
Sure. Okay. Hello, everyone. I'm Katie Mednick with Mom's Meals. I just have a few. Yes, sometimes I lose my voice when I project my voice. So if I stop talking, that's what's going on, but I'll try to project as much as I can. Like you mentioned, I'm a registered dietitian. I also have lived experience with physical disability. I have a collagen disorder. So
everything looks fine, but on the inside, I'm made of stretched out rubber bands. So I became really passionate when I was diagnosed in high school about kind of the intersection between nutrition, physical disability, accessible nutrition, all of those fun topics that we've had a lot of fun talking about today. I currently work for Mom's Meals. And raise your hand if you heard about Mom's Meals before coming to this event. It's totally fine. I'm just curious. You heard of us? Amazing. Okay, so we are actually the nation's largest provider of home delivered meals for folks who are in Medicaid waiver programs. If you're not familiar with the term Medicaid waiver, those are small programs in every state where folks who have a nursing home level of care get to live in the community with the supports they need to do so successfully. In Montana, the Medicaid waivers that I'm familiar with are the DDP program, Developmentally Disabled Program, right? Am I saying that acronym correctly? Okay. As well as the Big Sky waiver, which are for folks who are older with disabilities. So on both of those waivers in Montana, folks have the option to select services that would be beneficial for them. And home delivered meals are one of those options, which is really exciting. I do want to say that like all the other programs we've talked about, the exercise program, SNAP, SNAP-Ed, same scenario where phenomenal program for the people who need it, right? But utilization is very low. So I think Delaware has one of the highest utilizations of home delivered meal benefits for their Medicaid waiver programs. And I think it might be 50% or approaching 50%. I think in Montana, I don't know the numbers exactly, but I would guess closer to 5 to 10%. I think we have 40 people in the DDP program who are on Mom's Meals. And I imagine there's several thousand folks who are receiving services through the DDP program. So just one little takeaway for all of you. If you're connecting with folks, connecting with case managers, connecting with the state, I think there's a lot of interest in the food as medicine movement, how home delivered meals, medically tailored meals can be really helpful for chronic disease prevention, management, autonomy. But I think we're forgetting that there's already a program right now that exists and it can be further leveraged, utilized, and there can be barriers taken away who can promote that utilization. So for instance, if someone has too many, right, in quotations, too many personal care hours, sometimes they lose access to home delivered meals because there's an assumption that there's someone who can whip up really nutritious meals whenever the person wants to their specifications. And in our experience, that's not the case. I'm a dietitian and it would take me a calculator, pen and paper, and all of my tools to provide a menu for someone with kidney failure, for instance, for a renal diet, whereas Mom's Meals can deliver that to the doorstep and the caregiver or the personal care attendant can focus on things that are even more impactful, at that time, providing direct support. So that's a brief synopsis of kind of the home delivered meal benefit and program and what we do as an organization. And I did just want to mention a few other details, a part of our program, so you understand, who's Mom's Meals is and why we do what we do. So Mom's Meals was founded by a mom, go figure, trying to get food to her mom in rural Iowa. She wanted to live at home independently, but just needed extra support to do so. And so Mom's Meals was born. We've had contracts with area agencies on aging, as well as Medicaid waiver programs throughout the country since 1999. So we've been around a long time, which is why we're structured the way we are. So we're one of the only providers in the country who do a couple things. One of which is providing a menu to participants. So most of the time, for some of the local programs you might be familiar with, like Meals on Wheels, Monday is Meatloaf Monday, Tuesday is Hot Dog Tuesday, and there's no element of choice, and there's no integration of food preferences or even, specific chronic condition needs. So from the start, we've always had a very extensive menus. We have 9 menus, so anything from general wellness to renal friendly, diabetes friendly, pureed. The menus that cover the most common chronic conditions. So that menu element provides autonomy, dignity, choice. We also do refrigerated meals, which is very unique. Most folks do frozen or hot meals, right? You have to eat them when they get delivered. There's not much flexibility. You have to be home. Frozen meals can take a long time to heat up. And you might not be sure if you can heat them up fully, things of that nature. They're just a little more challenging. Also, people usually have small freezers. Your refrigerator is the largest, so you can store the most food. You have flexibility. Our meals last 14 days in the fridge. So you can choose, when you're going to quickly heat up a fully prepared meal. And the last thing I'll note that makes mom's meals a little bit different from other providers in the space is that we have a really built out customer care department to serve the folks that we connect with all day, every day. So we have 400 call center representatives in Iowa with an answer, like a time to answer within 30 seconds for live answer on the other end of the line. Our staff are really well trained to connect with the folks we serve. And we also, of course, have, we're connected to the Iowa Relay and other ways to connect with folks in a more accessible way. And that's really unique in this space to be able just to call someone up, ask about your deliveries, talk through the menu. And I'll even see notes in our system from customer care representative to customer care representative, just know that this person really likes these meals. She can't see very well, so she needs the menu read out to her, but she won't tell you that. So just go ahead and start reading out the menu at every call. And when I see things like that, I just know I'm in the right place. So that was a little overview of Mom's Meals. And I hope you learned a little bit about Medicaid waivers, home delivered meal benefits, and one of the providers, Mom's Meals, who has been in this space for a long time. Thank you.
About what you're able to do for people. And do you send the meals one at a time or a week at a time?
Either a week or 2 weeks at a time.
Okay.
Each cooler holds 10 to 21 meals. So we'll kind of find the map there or whatever the person is authorized for.
So now we have about 5 minutes for questions. I'm sure if you don't get your question answered now, you can find these people at break time and ask them. Okay, we'll let Kelly go first.
I have a question for, what's your name?
Theresa?
Brittany. On your presentation, if those rubber spoons that you show in your presentation, are they good for little kids? Yeah.
Oh, I think we.
Yeah, that's a question for Michelle. Rubber.
Sorry. Michelle, sorry. Those rubber spoons you were showing in your presentation, are they good for little kids' hands? Because they're so little. They'd be so hard.
No, we have all sizes.
Mary?
I just wanted to ask if Jacqui could talk about doing cooking classes remotely, because that's how we learned about Jacqui was during COVID.
Right, so during COVID, obviously everything had to go online, so we had to redo everything and go online. And one of the things that came out of it was that gave me the opportunity to watch as they did the recipe, so I can give them more feedback and more one-on-one. And so that has grown into, if they can't make the class, we still have it online on Zoom. Sometimes with this, if everybody shows up and there's only one, then I can't spend as much time, but at least there's that sense of community with them. They're still seeing their friends. There's still that camaraderie. And we have Matthew, whose parents are missionaries in Taiwan. And so that's expanded to that. And it's parents realize it works because they're comfortable in their own kitchen.
And one of the Jacqui sends the recipes and the ingredients home ahead of time, so the parent can get everything ready
Right.
and maybe
Right.
trial the recipe.
So to try out the recipe, and that was one of the things that we wanted to do was we would send out some of the ingredients ahead of time or the recipes ahead of time so they could prepare for it. And then that way they would still be participating rather than just sitting there and watching. So that was one of the good things that turned out and that continues to this day.
We had another question over here.
That was my
Oh,
question,
okay.
was are they being sent with ingredients? Are they doing their own shopping and getting the
Both.
ingredients?
They do both.
before?
So some of the parents will do it and the others will take it now to the grocery store. And that helps them because now they actually, the person has something to do, so.
Maybe we can take one more question before break. Is there anyone else that had a question they wanted answered? Well, if not, thank you so much.
Question.
Oh, over there, I'm sorry.
Any of you ever had a problem with those plastic knives ever chipping when you're trying to use them and everything?
Nope. It can get dull after a while, but that's after quite a while, it'll get dull, but I'm chipping on it.
Well, thank you, panelists. This is a really wonderful.